Well, our guest today is Bart Astor, the author of the Washington Post bestseller AARP Roadmap for the Rest of Your Life, Smart Choices About Money, Health, Work, Lifestyle, and Pursuing Your Dreams, and the best-selling book Baby Boomer's Guide to Caring for Aging Parents. Bart, thanks for joining us today.
My pleasure. Thank you for having me.
Well, I'll tell you, Medicare, when you first jump into it, seems like the most complex, vexing instrument until you begin to understand it, and then you start to appreciate, this ain't so bad after all. It's amazing, though, how many moving parts there are in Medicare.
Indeed, you're right. It is complicated, but it's like any kind of thing that you first approach something, it is complicated. Until you start getting into the weeds, you realize, oh, okay, I understand this part, I understand this part. But so you can navigate your way through, but at first, when you look at the whole picture of it, it's overwhelming. It's like anything. But I want to encourage people to get into those weeds because it's so important and to make the right choices. And so you have until December 7th. I want to encourage people. It's not that you're making choice over the course of the year. You are making a choice by December 7th and locking in your choice for all of 2018. So you don't have 12 months to do it. You have until December 7th.
Now, the one that to me is the most complicated of them all is this Medicare Advantage plan. Because they're different, they might cover you in this state or this county or not cover you there. It's one of those that seems like it could be better, I guess I might say, basically. Why is it kind of spotty like that?
Well, it's not so much from my perspective. The idea is that there's so many options, and so each option is something that you have to consider individually. You may decide that you want a plan that includes vision care, or you might want a plan that has dental insurance. Well, traditional Medicare does not cover either one of those. So if you're looking at some of the plans, the Medicare Advantage plans that do offer those kinds of additional services, then in fact you have to look more carefully. It's not that difficult, but you do have to say, well, do I want to compare this particular apple with this particular apple? But not to start to say, well, this one costs more and this one costs less, but this covers this and this covers that. Yeah, it's almost, sometimes you feel like you need a spreadsheet to just say, okay, well, what's covered here and there? But that's sort of the nature of making choices about what's individual for you.
Yeah, well, I'm going to here's the question, and I don't think this is putting you on the spot. I mean, what do you think is better, Medicare Advantage or a Medicare supplement?
They're totally different animals. Supplements, just like the word said, is in addition to Medicare. So it covers things such as deductibles that will not be included, whether it's a Medicare Advantage or traditional Medicare. Supplement is a whole different animal. What we really do want to compare is traditional Medicare versus the Medicare Advantage plans. And those are the two things that are different. And there are certain positives to each one. And then, so you're not comparing the supplemental plans. Those supplemental plans may have been called, in some places, called Medigap policies. This is a totally different animal that the survey did not ask anything about the supplemental plans, the Medigap plans. It's all about Medicare, traditional Medicare, and Advantage plans.
Okay, well that's a good distinction to know about. And in the intro, based on that study, we reported that basically people aren't doing a very good job of evaluating and comparison shopping. Why is that?
Well, I want to underscore, yes, they don't seem to comparison shop. It's kind of funny. I mean, seniors look at healthcare costs as the number one most burdensome health expense in their daily lives, including food and groceries and transportation utilities. Yet they don't comparison shop as much for Medicare as they do for things like their cable bills or their internet service or even travel deals that they might get. Why is a different question. It's hard to imagine, but people are hesitant to look at something that they think of as so complex and so confusing that they say, oh no, I'm just gonna, whatever I have right now is fine, I'm gonna stay with that. And one of the survey results I thought was particularly interesting is that seniors would rather do their taxes than review their Medicare plan. They would rather go to the DMV to renew their driver's license than review the Medicare plan. That's their perception of how complicated and difficult it is. But it doesn't really have to be that way. And again, once you look at the whole big picture, it's overwhelming. It looks so big. When you start getting into the nuts and bolts, and take small bites, it becomes manageable. And it isn't that difficult. But it is a little bit scary because you are locking yourself in for the year.
Yeah, it is a little bit scary in that sense. And I think when the first time out, when you hit 65, is when you get thrown into that. What's the best way to get up to speed on it and do some smart comparison shopping?
Well, there are a lot of resources available to those of us who are either just getting onto Medicare or who have been on and need to start reviewing our plans. And in fact, we really do need to review our plans on an annual basis and not just autopilot and say, okay, whatever I had last year is fine. But there are lots of resources. Medicare.gov is a wonderful site that offers not only helpful advice and information, but it really helps direct you for what's best for you. So when you're choosing a drug prescription plan, there are ways to determine what drugs that you are currently on that are covered in this plan.
Yeah, that's an important part, isn't it? Those medications can start to get pretty pricey, and it's best to understand how that works.
Exactly. And another good site is costofcomplacency.com. So that there you can also learn a bit more about the survey that was done, but also the kind of information that you're going to need to make the best choices. But there are other, one source that I think is underused. In each of the local senior centers often have local experts that will meet with people one-on-one. So not only are you getting information, but you're actually working with somebody to tailor your needs to what's available in Medicare coverage. So I encourage people to check with their local senior center and try to review the kind of Medicare plans that are available to them.
Okay. Well, I guess maybe we covered this question, but as we close out, Bart, any other tips to share at this point?
Yeah, I think two things I want to underscore is that December 7th is a hard and fast deadline. So it's not December 8th at 12:01. It is literally December 7th at 11:59. So it's important that you lock it in for this year. The other thing I want to underscore is please try to look at apples to apples. Compare what's important for you, whether you need to have additional coverage or whether you're only looking at the traditional Medicare, whether you want to include substance abuse and mental conditions, whether you want to include dental care. Those are not covered in traditional Medicare, but they can access them in the Medicare Advantage programs. So really try to find out what's best for you, what your individual health needs are, and then every year review it to make sure that you are still getting the right coverage and you're not leaving money on the table.
Well, beautiful. Bart, that's been very informative. I sure appreciate it.
My pleasure.
Our guest is Bart Astor, the author of the Washington Post bestseller, AARP Roadmap for the Rest of Your Life, Smart Choices About Money, Health, Work, Lifestyle, and Pursuing Your Dreams, and the best-selling book, Baby Boomer's Guide to Caring for Aging Parents. We'll be right back after this. I hope you liked the show and learned a thing or two. The full show will be available on YouTube and at BloomerBoomer. The audio version will be available on Apple Podcasts. And we have other shows coming up with some amazing guests. Please like us on Facebook and visit us at bloomerboomer.com. Till next time, so long.